We're taking a page from a really powerful project called the Museum of Lost and Found Potential. It launched in London last October as a pop-up, and it is a collection of items that represent the lost potential of people who didn't get the help they needed and the found potential of those who did.
My lost object is a watch. I had a trauma in 2013, which overnight I couldn't eat, sleep, work, function, and I really felt like I lost years of my life. Fortunately, I received amazing support. I'm very fortunate. And because of that, I was able to accept an opportunity and to take on the job of being campaign director for the Heads Together campaign, spearheaded by the Duke and Duchess of Cambridge and Prince Harry. Gosh, I haven't worn this in years. Heads Together, headband.
Nice. This is a prescription. And if you look at the name, it says Mr. Dalal. And that's my dad. So I grew up in a family with days when there were poverty, seasons of poverty, and when we were rich. And this was because my dad has bipolar. But growing up, my mom did the amazing things of hiding it and not talking about it to us because she wanted us to be, covered and not really just shelter us. And I grew up believing that my dad had that toxic masculinity, not talk about your emotions. My loss really is not having a relationship with my dad because of that perception that I had. I decided to become one of the psychiatrists in Zambia.
Wow.
I decided to say, I'm going to be the change, and I'm going to be the person who's going to help other people. And now my find is actually getting the same prescription that my dad gets and writing it for other people. But the difference is I don't always jump to medication. I jumped to investment in other alternative sources of health care in mental health.
I think we're learning enough about social determinants of health now to know that investments in those early stages will pay incredible benefits for mental health and physical health. So if you're a parent, if you're a community member, if you're an employer, if you're a corporation, if you're a government, right, the payoff to addressing these things is going to be huge.
Invest your time and thought into what are the core components that might underpin effective interventions. Don't outsource this thinking there's some expert out there that knows. Everyone in this room has something to contribute to that debate. Be part of the debate. Don't assume there's some magic out there. We together can find it, both with the investment of money and time and energy.
When you have movements of people, particularly young people, calling for change, backed with a roadmap that we have in the action plans, with actually being supported to do it, it can change the world. We've seen it in climate, we've seen it in other health issues. We haven't yet seen that in mental health.
All I wanted to do when I went public with my illness was to state out the symptoms and say to somebody that this is what I felt, and if you are feeling like this is probably what you're going through and experiencing, and you might need to seek professional help. Because I didn't want one single person to go through the journey of the unknown, which I had gone through. I think we need to, at least for the next 1 year, focus on destigmatizing and creating awareness. The funding is important. I think the data is important. I think research is important. I think localization and understanding every culture differently. But none of this will be successful if we're not able to destigmatize mental illness and if we're not able to create awareness about the importance of mental health.